Every pediatric patient will eventually need to transition to an adult provider. The age of transition varies between different facilities. Some pediatric facilities will allow you to stay in their hospital or in their office for an undetermined length of time, but it's really important to start to identify that you need to transition to an adult provider so that you are in a more age-appropriate setting. Every family can start to encourage their child to be more independent in their care. So they can make sure that the child will tell mom or dad when they're having symptoms, when they don't feel well. We can make sure that they register themselves when they go to visits. But then we want to make sure that families start to encourage them to be autonomous in other aspects in care. So for patients with more complex medical conditions who are on chronic medicines or on medicines that they take every day, families can start to encourage their child to be more autonomous in accessing those things. So that means having them call pharmacies and getting their own refills. And you can do it as young as the patient is developmentally appropriate.
Okay. Bye.
In order to get ready for the transition to adult-centered care, patients can start in their pediatric offices, practicing the skills that they need to know. I recommend that the patients sit next to the provider, making sure that mom isn't sitting next to the provider anymore and that the patient now assumes that role next to the provider so that they can be the person answering the questions. If the provider asks a question that they don't know, that they ask the provider to help them give them the information and then practice it at home, so that the next time they come for a visit, they will know the answer of what are their medications, what are their allergies, what is their surgical history. Also, the patients should be checking themselves into the appointment, so mom and dad don't need to give their name. The patients can go up directly and give their information saying, I'm here to see my provider. That way the provider knows that they're starting to be more autonomous in the care. Ideally, we want to encourage patients to start to be autonomous at the earliest age that is developmentally appropriate, and families and parents should be encouraging that. When patients come to a new appointment, physicians expect that they'll know their own medical information, that they know what their problem list is, they know what chronic conditions they have, they know what medications they take when they're sick, they know what medications they need to take every day. Understanding their baseline signs and symptoms is really important when they see a new provider. So if they normally have a high heart rate, they can express that, no, that's my baseline. That's not something that you need to work up, especially when they're seeing a new provider. They should know who their specialists are, and they should know who their physical therapist is. They know what pharmacy they use. They should be aware of their allergies to medicines and their previous medical histories, including their surgeries. It's really important that young adults start to carry information with them that will help them access healthcare should they need it. Families aren't always with our patients, and our young adults need to carry their own medical information. That includes an insurance card, a list of their medications and allergies, and a phone number of their providers. When you're transitioning from your pediatric provider to an adult provider, you have to be patient in establishing that relationship. Our patients have had 21 years or so to establish a really good working relationship with their current providers, and they often expect that relationship to be instant when they meet a new adult provider. So be patient with your new adult provider. You're going to be teaching them as much as they're going to be taking care of you. Often finding that adult provider is a challenge. Probably the best resource is other families who can give you their experience and let you know what providers have been advocates for their patients and their families. Even asking your friends, what adult providers do you use? If you are using multiple specialists, I often get recommendations from that pediatric specialist, what adult provider should I go to? Oftentimes, pediatric patients are seeing multiple specialists, and the specialists actually assume the role as the medical home for the patient. When they transition to the adult side, the patient themselves becomes the captain of that medical home along with their primary care provider on the adult side. I've noticed that there's been a difference between teenagers still being in the pediatric environment and still seeing young kids and toys, and they really want to be in a more age-appropriate environment, so oftentimes they are looking forward to getting into that older setting.
It is very hard for me to let her go and let her mature and be independent. And one of the things that I struggle with is that I always try to help her. And helping her all the time is making her kind of not be independent the way that it should be. So part of what we have done in the transition program is for me to let her go and for her to start doing it by herself. And it's been wonderful. She's doing good, and the support that we have with everybody has been wonderful.
I would say just try to do your best, try hard, never give up, don't matter what happens.